I'm Ivan, I'm 81 years old, and I look forward to reaching my 60th wedding anniversary in a couple of years' time.
I'm Michael, I'm 74, I'm in remission from cancer. I want to put what's happened behind me and enjoy the moment and enjoy my grandchildren.
Hello, my name's John, I'm 68 years of age. My plan is to keep enjoying life as much as I can, enjoy growing orchids and win a few more major prizes.
I am Denise, I am 71 years old, and I am at the moment just living in the moment. Okay, so I'd gone for my mammogram with my mum. We decided we'd go every 2 years. Driving home a fortnight later, I thought, oh, we haven't had our letters yet. Oh, they'll come. Both of us thought they'll come. But that day when I got home, there was a phone message from the breast screening place to ring back, and had to go back and have another mammogram.
It was 11 months ago, in November 2016, I went for what was to be a routine cholecystectomy, and it was when I went to have the clips taken out. The nurse was taking the clips out and the surgeon came in and said, we sent your gallbladder away and it has cancer and it's a type that sets up secondaries in the liver. So we'll be doing some follow-up with you.
I had been away on holidays, travelling with caravan, got a lump in the groin, which I didn't take a lot of notice of, and then a second one appeared before we got home. Visited the local GP, who then put me on a series of scans, inconclusive, other than a quick referral to the hospital to get surgery done, and that was how the first diagnosis was done. The pathology from that surgery came back saying that the lymph nodes had been removed and that they were full of metastatic melanoma.
My diagnosis was approximately 2 years ago. Within the clinic that I go to, there was a change of doctor, and he happened to say, your PSA's moved. Prior to that, the previous doctor would have probably said, it's an ageing process, you've had a colonoscopy, we'll keep an eye on it. He then recommended that I go to a referral to a urologist. The result of that, very quickly, they found that I had high-grade cancer in the prostate.
At that stage, I had no warnings, but immediately afterwards, then I started to find out what it was all about, using principally the internet, and my eyes were opened a little bit as to what was going on. That also prepared me for the subsequent interviews that were going to occur with the oncology section at the hospital.
I was a primary carer for my mum, and it was going to change her life, because I'm thinking, who's going to look after her? Because she has very low vision and balance is not really good. She's nearly 90. What am I going to do? So I'd sort of put myself aside for that moment and was thinking about what I had to arrange. What did I have to do? How serious was this?
It was like somebody throwing me a curved ball. Totally unexpected. I remember when I was 72, my son said to me, he said, you don't think you're 72? And up to that stage, I just bubbled on. And yeah, and all of a sudden, my goodness, things came to a halt, really.
Really, there was only one decision regarding my treatment, and the doctor in Melbourne, the professor, he was very frank, very straight out, and he said, it is a secondary that we're worried about. It is in your liver. It's in a spot where we cannot operate on. There's too many blood vessels, there's too many nerves and ducts, so the only option available to me would be chemotherapy. And I was happy to continue with that, providing I was having quality of life. I wasn't interested in quantity, it was quality that I was after. And that's still my decision, that I want quality.
Well, I went back to see the breast surgeon and she confirmed that I had breast cancer. I didn't really have many choices because the lump was so big that I had to have a mastectomy. Well, at the time my daughter was with me because I took her with me to take notes because I'm still in, I won't say denial, but still in, is this real, you know? So my husband and my daughter came with me.
Doctors then set out the options that were available for treatment, and there were basic two options given. One was do nothing. The second stage in the diagnosis then opened the option of going on to trials, clinical trials, and the final result was that we decided, because I discussed all of this with my wife, we decided that I would take on the trials if they became offered to me.
Well, the next step after the diagnosis was that the appointment was with the urologist, and he basically told me it was an aggressive cancer and it needed to be treated like that. I asked him the alternatives, and he said there was radiation and there was surgery. At that point I said, well, what would you recommend? And he said surgery. So on that basis, I decided that surgery was the way to go.
You asked about previous conditions. Yes, I do have. I'd been retired from work, or semi-retired for approximately 2 years, because one night at work as a nursing supervisor, things didn't add up, and I was diagnosed fairly quickly with early Alzheimer's, which I had treated, and because it was so early, it's plateaued out at the moment, and so that hasn't been a major issue. We all know that I do get confused at times, so I have a lot of things happening at once.
We didn't discuss my age. I was then in my late 70s. It was a bit of a non-issue as far as I'm concerned. I'm only as old as I reckon I am, and I was fit enough to know that my body at least was going to cope with the first round of any medication that might have been formulated for me.
My wife, being an ex-nurse, did ask the questions, and the specialist did, though, make her part of the conversation. She was part of the process. She wasn't the token lady sitting next to me. She was part of it. She was part of it, and that was quite good. I think in my mind, I wanted it out the way as quick as possible. That was a natural reaction. I think probably in hindsight, maybe I should have spent a little bit more time thinking about it. I think I did rush that a little bit. I did. Because I was so unsure.
The only thing that I would have thought of, and that I didn't even think of, and it was never raised with me, was to have had a double mastectomy. And I still don't know to this day, and I should probably ask the question, but it was never raised. And I wish now I had asked that question. The next morning, the breast surgeon came into the hospital with me and said, you know, all is good, you've lost 3 lymph nodes, but there's no cancer in the lymph nodes. And still, I didn't know what that meant. I was still under the impression that I had to have chemotherapy and radiation, but the way that was is that I didn't have to have the chemotherapy or radiation. So that fear of losing my hair and all of those sort of things that I'd planned previous to this no longer existed.
Initially, I thought, oh, I don't know how this is going to affect me. So my brother-in-law and his brother lives next door to us, and he's retired. So you better come to Horsham with me. I want you to drive, so I'm not driving back being stressed.
Well, the drug company running the clinical trials accepted me as a patient for the trials, and this was organised through the hospital. The treatment basically involved fortnightly visits to the hospital where you underwent a infusion, which usually took about a couple of hours. And for me, I was very, very lucky. I had no side effects from that treatment.
It was a fairly routine procedure. It was with a robot. It was keyhole, and 48 hours you're discharged. And I think that had been the procedure, and everywhere you spoke to people who had it, it worked. Yeah. In my case, 48 hours I got discharged, and I said to my wife, I'm not right. And what that was, that the exit wound internally, the organ attached itself to it, and that's when the problem started. Totally unprepared for it. Within an hour of registering, I'm in emergency. I spent 2 nights in emergency.
Well, first of all, I went to the oncologist, and knowing that I had to have a hormone treatment, but I had to go and have a bone density test first to see which drug I would have to take. And I said, what was the bone density test for? And she said, to make sure you haven't got osteoporosis. And I said, well, that won't be a worry. Unfortunately, it was a worry because the test came back that I did have osteoporosis and didn't know. So the only drug that was beneficial for me was the tamoxifen, because it's okay for the bones, where the other drug is, whatever the other drug was, is not good for the bones. So I did have a infection in the wound after surgery, and the nursing staff said, you know, that would probably take a little bit longer to heal, perhaps because of my age. That was mentioned to me. The people, they were very, very concerned and very caring, and very considerate of my age too, because a lot of the ladies I saw in the waiting rooms were a lot younger than I was.
The side effects from the chemo, the first little while, I didn't know what to expect or what was going to happen. I'd be feeling lousy, to be quite honest, for a little while. But now it seems to settle down that if I have the chemotherapy on a Friday night I have very little sleep. Saturday morning I'm usually fine up until lunchtime. Then the wheels start to fall off and I just feel, I'm a bit woozy here. So I'll go and lay down and go to bed. The Sunday morning I wake up as though I'm getting the flu. But I also know that I shouldn't make decisions at that stage, because whether it's, my friends say it's chemo brain, I say maybe it's Alzheimer's, but I know that I don't always make clear judgments. So I just plan on doing no decision making over the weekend, and then come Monday, I'm fine.
And towards the end of the trial, I was in the position where no growth, no melanoma could be detected on the CT scans. At that stage then, I started to get the first of my side effects. The first one was skin rashes, which were fairly severe. Then my hormonal system failed. Then further on, my kidneys started to decide to pack it in. And at that stage, and this is after some 6 months of the trial, I was actually taken off the trial because the threat to my kidneys was too severe. But I remained on the monitoring side of the trial so that the progress of reduction of the melanoma could be measured.
The care plans with my daughters was very interesting. We had arranged to go to Port Douglas, and my daughter and her husband from the Northern Territory came across with us. And although we'd really not had much contact over the years, up there was absolutely the best therapy that I could have had.
But the other overall effect was on my wife, and the constant attention that she was providing to just support me and do that type of thing meant that things like, again, car parking was a hell of a problem because it was so congested around the hospital, and also the financial burden of it became quite significant, particularly when you were visiting once or something, some occasions twice a day. Throughout all that, this had its effect long term on my wife in terms of her health and our well-being. We tended to at times get a bit cross with each other.
Well, I already had a will made out. Advanced care plan, never gave it a thought until doing this oncology rehab, and they let us know that how important that is, not for just breast cancer people, but for anybody, with any illness or anything, to know their wishes. So I have learnt a lot from the oncology program.
I reflected on it, but even before treatment, I had attended to wills, which had been in the family for quite a while. Powers of attorney had been attended to. Advanced care planning I was not aware of and was not made aware of until after treatment was completed and I had gone into a rehabilitation course. I was still reflecting on the aftercare planning and that type of thing.
I had a bucket list, or started to develop a bucket list of things that I wanted to do. I'd never been on a cruise. So with Anne's help, we had organised a cruise up the Australian coast across to Singapore. And my daughter, her oldest grandchild and her partner, my daughter's partner, met us in Singapore. So we were able, as a big family, sit around and discuss what I wanted. And I still have the confidence that if for some reason I couldn't make a decision, any one of those three could make the decision for me and everyone would be happy.
Well, I actually, after 12, when the 12-month time came around, I all of a sudden realised I've had breast cancer. I've lost a breast and I haven't had time to grieve. So in that period of time I started really grieving. So it was coming on winter, and instead of being active and going out for my walks and things like that, I actually sat in my chair, and it was easy to sit on the couch. And the longer I sat there, the more tired I got. And I thought, I didn't know what to do. So I went to see the breast care nurse again. She gave me a pamphlet on oncology rehab, and I rang them, and I'm back doing my exercise programs and getting information, and it's been wonderful, yeah. So getting active again, because the longer you sit, you think you're tired and you just sit on the couch. Well, that's only going to make you more tired. So after that grieving period, even though it was delayed, I've come through it once again through just asking questions, information that's out there, the oncology, the information coming through that program is just wonderful. And then they refer you on, which I'll be I'm going to another exercise program, which will keep me accountable, and I need that.
At that stage, physically, I was okay. I'm back doing what I normally do. I'm in the garden, I'm walking, I've gone to the gym a couple of times a week, doing all that. And unbeknown to myself, I got angry, not violent, I got angry. And basically my wife said, Michael, she said, you're becoming a pain. You're not pleasant. And she said, I think you need to do something about it. And I knew there was a change, but I'd never really recognised it right then. As a result, I saw my local GP, and within that clinic, they referred me to a psychologist. And that was of great benefit. In so much as it wasn't, he went back prior to the diagnosis, the surgery and all that, and just worked through it.
Take care of yourself. That's primary. Ask questions. Don't be afraid to ask for help, because help is out there. There is help there. So ask questions. There's just so many services that are available for people. And if you are new at this, you just don't know. So that would be my advice, is ask questions.
At the same time, I think try and get a positive attitude about it. Treat it as like having a cold or any other illness you may have, right? And don't see cancer as a death sentence, because there is that. With that, you mentioned the word cancer, and people say, that's, but there's not. There's a lot of people out there who have been in remission for years. So I'd say that don't see that as a death sentence at all, right? It's something that can be and will be fixed in most cases.
Well, previous to cancer, I just ran all day. I would, whatever I had to do for my family, I would do. Now I actually have time to not get up of a morning and not run. I have time to actually have breakfast and do that. And I'm doing this exercise program. I'm still doing volunteer work with a local community house. So yeah, it's improved my lifestyle now is probably much better than it was previous.
My real thing is that you're absolutely honest with your friends and yourself as to how you're feeling. You don't have to make a big thing about it, but you just let them know that I'm not being rude if I disappear. That's just how things are at the moment. But I appreciate you coming.
I'm going to say that my strength came from a new mindset, that maybe this breast cancer, and it might sound silly, has been given to me as a gift to Denise to look after yourself, where I've always looked after other people, that maybe it's time for me. So meditation and a new mindset of being positive and caring for myself, which is something I I really did. You know, really in a deep way. But the meditation was what got me through.
Another issue for older people would be to reflect upon the future for accommodation. At the moment, my wife and I live together in a single unit. It's convenient. We have access to all of the facilities we need. However, as we have aged, care issues occur in like house cleaning, and we have discussed this and what we might do in the future, but this can only be an issue that is going to increase with time. The garden, small as it is also an increasing issue.
Learning from other people, other women from the rehab place that I went to, all of the women, you know, just talking about their experiences, you know, it really has helped. It helps with talking to people because you learn so much from other people's experiences.
Being an older person, there are challenges with the cancer, but I think you're also, being an older person, you've already had challenges. And so you're working your way around those and you adjust your life according to how the day is.
I'm essentially a positive type of person, and therefore every step on the way is a challenge. If you can break it up into segments as it's happening, handle it day by day or week by week, and look to a positive outcome at the end, then I think you would do well. As I've got older, and with all the cancer experiences, and knowing full well the terminal nature of advanced melanoma, one has to reflect on where it's all going to end, what's it like, what's the future, life after, all the philosophical attitudes and questions that occur. And I guess this starts to rise up a little bit more at the back of your mind, even for a practical person.
The key to it all is also the medical team. And they are in constant contact with each other. They discuss things between themselves, and I might have gone and seen the oncologist on the Wednesday, and I have an appointment with the GP on the Friday for routine things. He already has all the information that we discussed on the Wednesday. And so you know that you're all working together, and that to me is essential, because you're not having to go over ground all the time.
I have changed significantly in a physical sense. My body is showing either the effects of the treatment or increasing age. And this is one of the things that comes into your mind often. I've suffered a side effect. Is it due to old age, or is it due to a side effect of the cancer treatment? Or in most cases, it's a combination of both. My skin, for example, is a mess, largely produced by the treatment and the use of blood thinners. But when you start to look at 80-year-old people and their skin, it's also in a bit of a mess. So one of the realities I've had to face is the body is ageing, and I don't like it, but I'm philosophically accepting it.
Well, it's the one thing that I found is it's not the end. It can be the beginning. It can be the beginning of a new life for you. It really can. It can be not, where at the beginning you think, well, this is it. This is is this all there is? But it's not. There's so many more things that are available if you just want to reach out and get it.